So hello and welcome you all to Sail to MDS Dental Academy. I am Dr. Malati, the pediatric dentist and professor in College of Dental Sciences. So now dear students, we are with the part 3 for the RPSC past paper discussion with important concepts. So let's begin with the video. So the question is, which of the following is the most appropriate related to hardness? So here the correct answer is tungsten carbide. Remember, it is extremely hard substance followed by porcelain, human enamel and the acrylic. Many times students make the mistake that they used to select first human enamel, but it is wrong dear student. The first is tungsten carbide followed by porcelain, then human enamel and then acrylic. Then second question, palatal lift process is useful for which all patient? Again, the correct answer is all of the above. You can use for myasthenia gravis, cerebral palsy and bulbar poliomyelitis. Let's see what it is the palatal lift process. You can see this is the appliance which used to close the palate. What they do, they help to manage VPI, there is a velopharyngeal incompetence. What it is the inability of the soft palate to close against the wall of the throat, that is the pharynx. So it helps for proper speech and swallowing. Now, which of the following patient has a chronic hepatitis B? So the correct answer is HBs positive, anti-HBC positive and anti-HBs negative. So now dear student, you have to remember these three important points for the hepatitis. Anytime they can ask you acute hepatitis, chronic hepatitis, so you have to remember. So remember, whenever the word anti is not there, it means the patient is currently infected. The latest infection is there. Okay, and whenever the word anti is there, it means the infection may be past or chronic infection. The chronic infection is running since long time or the patient is vaccinated. If it is B core antibody, it means a past or ongoing infection. It is B surface antibody, it means the patient is vaccinated or maybe past infection. So this 3 points you have to remember. Never ever you will go wrong in any hepatitis B question. Now the material favored for bottle molding of partial maxillectomy defects with the smallest static defect or large undercut. So the correct answer is thermoplastic wax followed by elastic material. Why thermoplastic wax? Because of its malleability and ability to conform closely to irregularities in the defect area. And what they do, they provide a well adapted impression for the final processes. If the option B is not there, then you have to go for selection of the option 1. Now, which is a special sensory supply to anterior two-thirds of the tongue? The correct answer here is coda tympani. So what it is? So the coda tympani is a branch of facial nerve, cranial nerve 7. So the coda tympani usually targets the lingual nerve to reach the tongue. Okay, but mostly it is responsible for the taste sensation. Now, the cutaneous receptor which mediates sensation of light touch is what? The correct answer here is Meissner corpuscle. So they are involved in skin movement and object handling detection, and the primary stimulation is through dynamic deformation. So dear student, you can say this is the Meissner corpuscle and this is the Ruffini corpuscle. Mostly you can see it little bit, it looks like a stretch. You can see the shape. So you can remember this shape and you can remember it's for skin stretching, movement and finger position. The Schinian corpuscle look little round, so you can remember like round and you can see some lines are there, so that help you looking very fine. So they help to sense vibrations and detect fine textures. And the Merkel nerve endings, very easy to remember, they are known as Merkel disc also, they detect sustained pressure. So please remember this diagram. Never ever you are going to go wrong in these 4 nerve endings. Now all the following are correctly matched except, so remember the alpha cells of pancreas glucagon is correct, epicellular cells of pancreas ghrelin is correct, adrenal medulla epinephrine is correct, but the D zona fasciculata aldosterone is wrong. Most often the aldosterone is produced by zona glomerulosa. It is the outer area of adrenal cortex. Zona fasciculata is the inner area of adrenal cortex and they help in produce cortisol or corticosterone. Okay dear students, so that was all from my side in part 3. Please watch part 1 and part 2. If anybody want help for your RPSC or any of the government exam or NEET MDS, the information is in the description box and also on the screen. You can contact me. Till then dear students, take care, work hard and keep on doing.